Hello and welcome to this video, and it is about Eustachian tube dysfunction, understanding the causes and the symptoms and how you can deal with it as well, of course. So the video will go through everything you need to know on what the Eustachian tube dysfunction is exactly. It will help you understand about it and, most importantly, give you some ways to deal with the symptoms. So what is the Eustachian tube in the first place? Well, the Eustachian tube, it's a small canal that connects the middle ear to the back of the throat. It helps to regulate air pressure and drain excess fluid from the middle ear away. So Eustachian tube dysfunction, or ETD for short, occurs when the tube is blocked or does not function properly. Now, this can lead to a variety of symptoms, including hearing loss, pain and discomfort, and temporary tinnitus. I will add, it can lead to permanence if left unchecked. So you should always have anything checked out anyway. Any health condition, if you've got it for more than 3 weeks, you should have it checked out. Okay. Now, causes of Eustachian tube dysfunction. There are several factors that can contribute to ETD, including upper respiratory infections, or in normal speak, the common cold, flu, or COVID-19. Yes, so all these can actually lead to this. The other one, and probably one of the biggest ones, is allergies. So you may find you get this certain times of the years. Sinusitis, and that can be, an issue for a lot of people, and it's easy to deal with. This is the thing. Now, a lot of these are ones that you can really help yourself with, because another big cause of this is obesity. We have to say it, we can't shy away from it. We're our own undoing at times. Now, we all make our life choices, and that's fine. It's your own choice, but it can be a big factor. And coming on to another one that we all make choices about, smoking. Now, as a former smoker from many years ago, before I knew better, 30 odd years ago, it's terrible. It can cause lots of things, and one of them is problems with your Eustachian tube function. So stop smoking if you want, or when you decide. Okay, next, air travel. You see, flying in those planes with everybody's germs floating about, and the changes in the pressure in your ear can lead to lots of problems, such as the Eustachian tube dysfunction. And I suppose this comes on to the next one, which is altitude changes. Now, this can be just as you're driving along, going up hills and going down again. But altitude changes are more, obviously, the larger when you're flying in a plane, obviously. And unless your pilot's going to keep it on one level, which is highly unlikely, then yes, this is time you can suffer with Eustachian tube problems, blockages. Coming on to blockages, so to say, is in the Eustachian tube can be through earwax or fluid buildup. Now, if it's earwax, don't go sticking those cotton buds down, or swabs, as they're called, the other side of the ocean, aren't they? Yeah, don't stick them down, they'll make it 10 times worse. Right, the symptoms of Eustachian tube dysfunction then. You see, the symptoms of ETD can range from being really mild and not hardly noticeable to severe, and can include a fullness or pressure in the ears, hearing loss or muffled hearing. And now tinnitus, the ringing in the ears, it can even be affected in just one ear. Pain in the ear, so earache, and it can even cause you dizziness or vertigo. Right, so to get diagnosis and treatment of Eustachian tube dysfunction, diagnosing ETD is typically done through a physical examination, including a thorough review of the patient's medical history, because I think a lot of people, once they've had it once, will tend to get it over and over again. And a hearing test in some cases as well, this needs to be done. Further tests, if it hasn't cleared and there's no obvious reason, could be things such as an MRI or CT scan. But this is really, in extreme cases, it's unlikely. In most cases, it's highly unlikely and not needed in the short term. As I say, a lot of these can go away on their own. So, treatment for ETD, of course, depends on the underlying cause of the dysfunction, but it may include decongestants, You can use some of the homemade remedy ones that are about. Antihistamines to help relieve the symptoms caused by the allergies, and take these before it actually starts. This is the other thing with a lot of these things. You know, take your antihistamine before you're actually getting really bad with it. Don't wait until it's really bad. Okay, cold, you know, simple cold remedies. Nasal sprays to help unblock the Eustachian tube, and ear drops to help dissolve earwax. In really extreme cases, if the dysfunction is something that you're born with, or there's some misshape with your Eustachian tube, which can happen. There's a lot of various conditions with this. Surgery could be the answer, but that's really in severe cases, and it's highly unlikely, but it is an option, or a possibility, should I say. So how do you actually prevent Eustachian tube dysfunction? Well, there's a few steps you can take to help it. So one is, we've got to go over it, maintaining a healthy weight, not smoking, treating allergies and sinusitis promptly. Don't leave it. Cider vinegar and all that looks great. Okay, avoiding sudden changes in altitude, which is a bit difficult if you're on a plane. You just have to, you know, fly. That's it. Okay, just think of what you're doing when you get to the end of the flight, if it's a holiday anyway. Chewing gum or swallowing regularly during flying, air travel. You know, when you do this, it releases that pressure, and it can keep the Eustachian tube open and the fluid flowing. So keep yawning all the time when you're on the plane, and chewing your gum. Okay, conclusion then. Let's have a little conclusion on this. You see, Eustachian tube dysfunction can cause a range of symptoms, and they say they're usually mild in most cases, but they can be really painful with your ear pain. It can be horrendous. I've had it going back some time now, but it can be pretty bad. But I would say, if anything like this, if it lasts 3 weeks, seems to be, I think, the cut-off when you say, right, we've got to have this dealt with. Go to your doctor. You should always see your doctor for any diagnosis anyway. This video, I'm giving the information out, but I am not a doctor, and I'm not advising you on anything. Okay, it's for informational purposes only. Their disclaimer done. Okay, so it's important to understand the causes and the symptoms of your Eustachian tube dysfunction, and to actually treat the cause itself. So the other is maintaining good ear health. You know, looking after your ears. I know cleaning out, but don't use cotton buds. They're terrible. Or swabs, if you say it that side of the water. Okay, so if you suspect that you may be suffering from Eustachian tube dysfunction, it's important to see a doctor to get a proper diagnosis. Okay, and then take a plan of action with it. Okay, on that, I would like to wish you all good health. Take care. Have a look at the website, because there's some help on there with ear problems and tinnitus and lots of other things. So I would like to say goodbye for now. See you in the next video. Bye bye now.